Hey everyone, I just wanted to hop on real quick and say today's episode on menopause is a very real, honest, and unfiltered conversation. We will be covering some sensitive topics, so please keep that in mind as you listen. So, with that being said, let's dive on into Man, I Need to Pause. You're listening to Empty Nexters, a podcast about finding joy, beauty, and wonder in the next season of life. What's your next? Well, hello, everyone, and welcome to the Empty Nexter podcast. I'm your host, Shelley, and I am so excited to be with you here today. I am super excited to have, once again, in the studio, my girl, Kelly. What? Everybody give it up for Kelly. She's my co-host today. And, Kelly has done a couple episodes with us. And if you haven't listened to them, I encourage you to go back and check them out. But also, when we were talking about the next episode that we wanted to do, we thought it'd be very interesting and enlightening to talk about the exciting topic that brings joy and fun to women everywhere. Yes, you guessed it, menopause. I need to take a breath just a minute before I keep going. And when I was thinking about the title of this episode, you know what the first thing came to my mind? I thought, man, I need to pause.
Yes.
That's right. We're going to pause a moment and we are going to have a fun and informative talk about how we as women can manage, survive, and thrive through this season. So let's dive in. And I'm going to start out with just a personal story about my life. I am 58 years old, and the word menopause really never entered my vocabulary until I was probably late 30s, maybe 38, 40.
Oh, wow.
My mom never discussed it. Apparently, her generation never discussed it until my mom literally had a breakdown. We didn't know what was going on. Long story short, we found out she was in full-blown menopause, and we got her situated and settled. But even after that, we still never discussed it. I went into married life, had children. None of my girlfriends discussed it. Then I hit the wall about 40 with, what is happening to me? Am I losing my mind? My body is off the chain crazy. So, Kelly and I thought it would be a great opportunity for us to sit down and let's bring all the crazy out. Let's have an honest conversation. And we are super excited that Kelly has an amazing guest that she's going to introduce to us today in the studio. So Kelly, take it away.
I am so excited. I've shared in previous podcasts that I'm not really a lover of doctors except one. Well, two. I also like my pulmonologist. But I have my primary care physician here. She is a concierge doctor. She specialized in internal medicine, and recently she got Menopause Society certified as a practitioner.
Come on. Yes.
Could it
if
get
I had
any
sound
better
effects,
than that?
we'd be clapping right now. Thank you.
She is Dr. Krista Springston, and she works in Peachtree City. And I highly recommend her if you're looking for a primary care physician. So, Dr. Springston, would you mind telling us a little bit about the physiological and the medical of this big word?
Those were big words right there, Kelly.
Nothing like diving in feet first.
That's right.
There you go.
With all you got.
Yeah.
Kind of like how menopause does to
Oh,
us.
hey, I like the way you did that. That's awesome.
When I die, the first thing I'm going to do is ask God why we have this immediate precipitous drop of our vitality hormone.
I think that's great. Good
I'm
idea.
still mad at Eve.
I know. Me too.
That may be the answer. We don't know. There's a lot that we don't know. You'll get that a little bit as a theme. But yeah, we haven't talked about it. And I'm so thankful that the tides are turning.
Yes.
I grew up and knew that I wanted to explore the body more, went to medical school, and I did internal medicine, which is generally the thinking part of grown-up medicine. So I can take care of diabetes and asthma and high blood pressure, and we work on cancer prevention. But there was this underlying theme of the women in my practice in their 40s and 50s that were not getting the medical care that they needed because there's a whole generation of doctors that really did not get the education.
Yeah.
So I took it upon myself to go back to school, essentially. And I've been working on this additional certification for about a year now.
Wow.
It's amazing. The things that I've learned, it is almost like drinking through a fire hose.
Oh, wow.
And it culminated with a big test I took about 6 weeks ago and then found out 4 or 5 days ago. Well, I wasn't really worried, but I passed it. So, yeah, now it's official. It's nice to have that designation so that patients or people that are curious can go online and find doctors that are more versed in taking care of women going through this hormonal transition.
Right. That's fabulous. Yeah. Because you made the comment earlier, I don't want to be a martyr anymore about menopause. What does that really mean?
Doctors would tell you it's just your hormones. There's nothing to do about it. And it's just your hormones. That's a natural part of life. It is something that everybody goes through. You know, some women have it easier than others. I remember attending in my training, told a patient, oh, if you don't have any symptoms, don't tell anybody because they'll beat you up.
Oh, that is so true because I do that. I mean, if there's somebody that says, oh, yeah, I've just breezed right through it, never had a hot flash, my moods were great, I'm like, get out of my face.
Yes.
I will hurt you because I'm having all those things.
Yes.
And the anger issues. That doesn't
Okay, I didn't want to bring that up, but yes, anger.
There's 32 symptoms associated with menopause, including, is it tinnitus?
Yeah, ringing in the ears, itchy ears, dry eyes, plantar fasciitis, frozen shoulder, irritability, insomnia. In addition to all the usual ones.
Okay, so my first question, I'm just going to hit it hard because my brain. So she said the physiological part of the body. What age does the women's body start kind of getting ready for that season?
Oh, getting ready.
It takes a minute, right?
It does. The average age of menopause, and we'll dive into the exact definitions next, but the average age is 51 in the United States. But perimenopause is the changes leading up to it. And that can start as early as late 30s, 38, 40. And it could be a 10 to 15 year ordeal. I like that word.
That's so not fair.
Interestingly,
10 to 15 years.
10 to 15
and
years.
things that you wouldn't necessarily think, oh, that's hormones or that's perimenopause or that's, like we talked about, all the weird symptoms. A lot of it starts with joint stuff and painful joints. And they've coined it musculoskeletal symptom of menopause.
Wow.
I have no words right now.
So one thing to kind of delineate is that menopause is actually only a day. It's only a day, and it's exactly 12 months after your last cycle ended. Mm-hmm. So when people are like, oh, I'm menopausal, they're actually postmenopausal, and perimenopausal is kind of leading up to it. Premature menopause is actually when you have it before age 35.
Wow.
And sometimes you welcome it, but sometimes you really don't want to because of the lack of that vitality hormone can set you up for diseases earlier or in a more aggressive fashion in your 40s and 50s.
Wow.
So when I say martyr to menopause, it's not just putting up with your symptoms. It is also working to prevent the things that the lack of estrogen causes, like cancer, Alzheimer's, osteoporosis, fractures.
Yeah.
And so people can really benefit from hormones, even if they are sailing through it like your friends.
Oh, wow. Not too many of my friends are. Or if they are, they might not be my friends anymore because
exactly.
I just can't relate. No, I'm just kidding on that one. But if you want to jump right into what you were going to say about the definition and all the medical terms and stuff, we would love to hear from you.
Yeah, because
that.
perimenopause is a newer term on the scene.
Yeah.
We've only been hearing that one maybe a decade or so.
Right.
one of my favorite non-clinical terms is calling menopause cougar puberty. Because that's what it is.
Are you kidding me? Okay, that's a new phrase.
I have never.
I've never.
But if you think about it, we kind of normalize teenagers going through extreme hormonal fluctuations, but it's not discussed for 40-year-old women.
That's true.
And it's not dinner table conversation. You talk about not knowing the definition of menopause. My 12 and 14-year-old boys roll their eyes, but they know exactly what it is.
Well, I think we were just talking about that before we came on the air with Kelly's son.
My son called me this morning. He's 35, and we were talking. He asked what I was doing today, and he said, "What's it on?" And I said, "Menopause." And just casually, he said, "And you're in menopause?" And I said, "Yes, I had a hysterectomy." But I told Shelley, that's how a conversation should go.
Yes.
Because his future wife will go
Yes.
through menopause, and he needs to be aware. It needs to be a common conversation.
Right.
Right.
That's good. Wow. So take it away. And if I was coming into your office for the first time and I was 35, what would you tell me?
The first thing I would ask is, well, would you talk about any of your health concerns that you would have? And sometimes people bring lists and we go down the list bullet by bullet. And sometimes they're like, I just want to be healthy. And one of my goals for all of my patients, men and women, is healthful longevity. I don't necessarily want to keep you alive at all costs with a miserable existence on earth. I want you to be vital. I want you to have a functioning, able-bodied existence on earth so that you can do what you want. So you can do what God put you here to do and not be limited by an ailing body. And so I start with that. And a lot of times I will ask patients their thoughts on menopause, their experience with their mothers, if that's something they have the history with. And then I'll ask them their thoughts on hormone replacement therapy and what they've been taught, how they were raised, if they even discussed it at all. Because unfortunately, and this is one of the things I'm trying to write, there was an entire generation of women and doctors who were failed by the medical system. In the 1980s and 1990s, there was about 60% of women who were in menopause were on hormone replacement therapy. It was the normal standard of care. Those were different formulations than what we have now. But in 2000, they were like, we want to do this study to make sure that what we're doing is what we need to tell people to be benefiting from them. And that the Women's Health Initiative came out of that, and it set us back. There was a lot of great data from that study, but the baseline or the reporting from that was skewed. And it said that hormone replacement therapy causes breast cancer and heart attack.
Yep. That's where I was.
Yeah, I was going to ask you because you said a few minutes ago that hormone replacement therapy could help
Prevent.
Prevent. And I've been on hormone replacement therapy for 12 years. So I had always, in the back of my mind, thought it could be a cancer-causing thing long-term.
Yeah, I was the opposite. I was on it for 7 years and went off because of fear of I would get whatever. And no doctor told me otherwise. They didn't say, oh, no, it's a different day. There's bioidenticals now that are better formulated for your body. Never got that. So I just now at 59 am back on them.
Yeah.
And I'm like, why did I come off? I wouldn't have gone through maybe all the, excuse my word, hell that I've gone through for 10 years.
Right.
But I wasn't informed. And so that's why we're doing this today.
Good.
Yeah.
In that study, they used conjugated equine estrogen and Premarin, which is a synthetic progestin. And they found that in women that used it at high doses for decades were had an increased risk of breast cancer in their 60s and 70s. And so that's all that anybody heard. That's all that got reported. In fact, the researchers had a press conference before the data came out saying that we stopped it early because there was a statistically significant increase in breast cancer in the women that had uteruses that were on both estrogen and progesterone. And they scared everybody, including doctors.
Yeah.
And when I went through, it was only if you have to, at the lowest dose possible, for the shortest amount of time possible, you have to go over all the risks of all the cancer it can cause and all the heart disease it can cause, and only if you must.
Wow.
And it was only recommended after you finish menopause. So after that 12-year point. So like you're suffering.
No,
Oh, wow.
this makes so much
years.
sense now.
It does.
Right. And so, yeah, my mom's generation were hosed, to put it lightly and non-clinically.
Yeah.
You had women suffering. And so there are a lot of great menopause advocates out there. Dr. Mary Claire Haver is a great one. Dr. Rachel Rubin is a great one. Heather Hirsch. So if you ever get the opportunity to read any of their books or listen to any of their podcasts, they are a great resource spearheading the menopause revolution. And I'm here to do my part to help clinically with one-to-one on my patient encounters, but also here with you.
Yeah, that's the reason we're here, is that we want to inform the next generation, the 30-year-olds coming up, because 30 to 35 to 40, your body's going to start changing. And that 40-year-old window for me, it hit me so hard. And I want to let them know, hey guys, you're going to make it. It doesn't have to be this hard.
Yeah.
Listen, get informed, talk to people, talk to the women ahead of you. Like, give me a holler. I will tell you what I've learned, the good, the bad, the ugly, and let's do this and bring it into the light, which I've seen a lot in our society today, that it is a whole lot talked about a whole lot more back then, as opposed to back when my mother was coming up and when I was a young woman. So I'm grateful for what you're doing to try to educate. That's huge, because it doesn't have to hurt this bad.
No,
it doesn't.
There's
it
a
doesn't
lot
have
of
to be isolating.
That's it.
Yeah. And it can be. What is happening to my body? I don't know who this person is. Am I crazy? And it takes a lot to reach out and be vulnerable and explain symptoms, because a lot of them are mental health and mental health changes that you're like, where is this coming from out of left field?
Yeah.
Anxiety, depression. It tends to happen in the 40s and 50s when they've got the younger generation on their plate, the older generation on their plate. We talked about this earlier, but they're at the peak of their careers, so they are juggling.
Right.
And then you throw this in, and it's like batting the balls off your juggling plate. And what is happening?
Yeah.
It can be a fun roller coaster, just like life.
The most
Awful roller coaster.
awful. Yeah, I was trying to think of the right word. The
Like a
most
fun
awful
house.
fun house roller coaster that you just don't know when it's in the dark. How about that? Like Space Mountain, you just go down and you don't know when you're going to come back up.
See, you guys did a much better visual. I'm envisioning the roller coaster that fell.
Oh yeah, like the Tower of Terror. I want to know, what about, I would like to see us bring get the men involved more, because, I feel bad for my husband. I mean, he has been the most patient, understanding person. He doesn't know, it's getting better, but he didn't always know what version of his wife he was going to wake up to in the past 10, 15 years.
Yeah.
Like I said, I'm heading towards 60, and I really started at 40. So is there a way to have those conversations, like even with the young 35-year-olds, to get them ready for marriage, to say, listen, you might want to be mindful of.
Right.
Yeah, there's some correlation with how bad PMS symptoms are with how bad menopause. So that gives you
That
a
makes
little
a lot of
bit
sense.
of a window into the potential for more rocky transition with
What about
menopause.
how your mom was?
My mom?
I mean, does
in
it
general.
relate to your own menopause story?
Some, yes, not always. And again, the women that are 40 and 50, a lot of their mothers had hysterectomies because that's how they treated
Yes.
dysfunctional uterine bleeding and abnormal periods and
Yeah.
polyps and endometriosis. They just took the uterus and the ovaries out and put them into surgical menopause, which is even more of a precipitous drop. Like you are so much more at risk of the lack of hormones with disease later in life with surgical menopause.
Wow. Yeah.
So, and I don't know when I went through because my mom, or when I'm going to go through because my mom
Your
had,
mom had it.
yeah, just anybody.
Mine did too.
With,
yeah.
Yeah.
She had hysterectomy later on. Yeah. Yeah. And they put
because
her
she'll
on something.
probably listen to this. My mom did not have a hysterectomy. I asked her the other day, when was your hysterectomy? She's like, I didn't have a hysterectomy. So I was way off. Sorry,
I
Mom.
did have a hysterectomy, and I had terrible periods. But my mother didn't discuss her periods. I just remember her being hot.
Yes. Yeah.
Lord, that woman was hot.
Yeah. And I have a question. It's just all these questions are coming.
Sure.
I was told that basically menopause is as if your ovaries are just burning out. Is that a correct way to describe it?
Yeah, the ovaries just not very gradually stop making estradiol.
Yeah.
And there's 3 different types of estrogens, but it's the primary one after pregnancy is estradiol, and it just kind of fades. Sometimes really quickly, and sometimes over a decade or so. Interestingly, with the hysterectomy, because you are taking the blood supply of the area, sometimes even if you leave the ovaries, about a quarter of the time of hysterectomy, you can also go into menopause, even though they left the ovaries. That's kind of, semantics, but the doctors are being kind and not ripping them out as well. And, but sometimes they can still put you into menopause. Something I actually did not know until I went into this further education.
Wow.
Yeah, they told me because they left my ovaries, I wouldn't go into it immediately, but that I would catapult much faster. Mm-hmm. And I was 42. So can they take blood, or how do they, other than when you've been off your period for 12 months, but someone like me, would you take blood and say you're perimenopausal, or someone who's in their 30s, or that someone like me who had a hysterectomy, okay, you are now full-fledged postmenopausal?
So we can take blood. The interpretation of those results, it can be tricky because in puberty, the hormones are all over the place. You're checking it at one particular spot, and it can tell us what part of your cycle you're in. If you have a hysterectomy, we can still estimate if you're in the luteal phase or follicular phase of your cycle. Or if the FSH, the follicular stimulating hormone secreted by the pituitary to tell the ovaries go into action, give us an egg, if it's really high, it's telling me that your ovaries aren't working well enough. It's telling me that you are either in your FS surge of your cycle, which is usually just 1 or 2 days, or it's working hard to get your ovaries to work harder and they're burned out. Yeah. So yes and no. When you are definitively menopausal and you don't have a uterus, you can't tell on bleeding, then it is a high FSH and a low or undetectable estradiol.
Okay. Well, some of the other symptoms or things, can we kind of dive into those?
Absolutely.
Oh,
yeah.
This is going to be fun.
I think hot flashes are literally and figuratively of the devil.
Yeah. Amen. Yeah, that was kind.
Your own personal hell.
If you have not experienced a hot flash, there is no way that we can truly describe the hell that you will experience. It's an inner heat that consumes your inner body. It's a furnace. and it comes out through your hair.
I wish I had a
typically
visual on you.
right after
my
you've
goodness.
done your hair.
Yes.
Or showered.
Or
Yes.
showered,
So
yeah.
it comes out your head, and it makes your hair do things you never knew it could do. And your makeup slides off, kind of like that Raiders of the Lost Ark guy. And you start sweating and looking like you just ran 6 miles. And then you start stress sweating
Yeah.
because you don't want anybody to see you sweating, and there's no way to stop it.
Yeah.
And I have heard once I come off these hormones, they could last forever.
They do, because that happened to me when I came off. She told me when I came off, she said, just going to let you know, you paused menopause by going on these meds. You paused all the things that you were dealing with. When you come off these HRTs, you will go right back in. She did not lie. And it came back with a vengeance. And so that's correct.
So if you would have stayed off of them, how long?
10 years.
Yeah.
10 years.
Up to 10 years.
Yeah, that's what she
Women, we
Yes.
got the bad end of the deal.
But there's hope.
You know, you brought up a good point in that we are kicking the can down the street. We are pushing off our physiologic menopause, and I'm okay with that. We are living longer than we did 400 years ago. We have sanitation and antibiotics, and there's a little bit of, longevity just because of medical care and improved life and living conditions. And so, yeah, I'm kicking it down.
I
the
love
can.
that.
It's okay, and we have the ability to do it using hormones through pharmaceuticals that are identical to what your body makes.
I've only been back on a month, and
You feel it?
It's been like night and day. I sleep better. I feel better.
Yeah.
It's a huge thing for me.
Well, I'm
and
going
when
to
you have the ability to slowly taper, that abrupt discontinuation isn't as uncomfortable. So we have a
Okay,
little bit
so
more control.
wean when you do
Yeah.
it.
Yeah.
Okay, I'm going to jump in with a question not for the kiddos. Libido.
Right. Yeah.
If you're not on hormone replacement and you're truly postmenopausal, I'm assuming this would affect your libido.
Yeah.
Absolutely.
Yeah.
Absolutely. And there's a lot of argument in the sexual health community that estrogen is the key driver of libido. You also have to consider the changes that lack of estrogen does to your vagina, your vulva, your clitoris. You have what's called vaginal atrophy, and it thins that skin down there. It's not as robust. It's not as plump, and it doesn't provide as much lubrication. So libido, is also affected by how much you want to have sex. And if sex hurts, that also limits how much you're ready and willing to go for it.
Yeah.
So it can also be treated topically just in that area. It also can help prevent urinary tract infections because that mucosal lining is the natural defense mechanism for bacteria not going up into your urinary tract.
And that's a terrible thing for older people.
Yeah.
It's awful.
Oh my goodness. Yes.
I mean, that's because sometimes they think it's dementia if it's
Right.
that bad.
Right. There was a big FDA roundtable about 3 weeks ago with menopause experts begging the FDA to take off the black box warning for topical vaginal estrogen, saying that it doesn't cause breast cancer because it doesn't get absorbed systemically, just locally,
Right.
and you get the benefit. So there's no reason you cannot have a 90-year-old, even
Right.
with a history of breast cancer, on topical vaginal estrogen to prevent UTIs, which can prevent urosepsis, because older people don't read the book on UTI either, where they don't get the painful urination. They don't get the pelvic pain. They just get a little wacky, a little
Yes.
wobbly, and they don't even have fever. So just preventing that and keeping them from having that infection by supporting the genitourinary symptoms that can come with menopause.
It's amazing. It's amazing how one season of your body affects so much.
It's a third of your life.
Yeah.
It's a third of women out there.
Yeah.
And we have a lot of pull. So it's time to be.
We really do.
It's time to be adamant with your
Yeah.
doctor that if they don't know or understand, they need to get educated.
Yeah.
And if you don't have a doctor helping you with this, I have one for you.
That's right.
All right, I'm going to ask another embarrassing question. In my late 20s, early 30s, my fabulous stepmother-in-law told me that once you start towards the menopause age, the hair on your head thins
Hair on your
and
chin.
the hair on your vagina thins. And recently, I asked my waxer lady what was her oldest client, and she said 71. And I about smacked her
Wow.
because I thought, surely I was getting close. I'm 54, by the way. I'm about to turn 55. Is that a thing? Because I know I am growing them on my chins now.
Yeah. Yes. So hair loss is huge and it's so frustrating for women. And there's other ways to help treat that, but estrogen is a prime driver. Really, if you consider it, there are estrogen receptors in about 95% of tissue in your body. So there are heart estrogen receptors, liver estrogen receptors, musculoskeletal, bone, eyes. Your vision changes with
Yes.
hormonal changes. And
I can't
so-
wear contacts anymore.
Yeah. We talked about some of the more obscure symptoms, but just the dry eyes, light sensitivity, changes in vision, phantom smells. Today, I had a woman who tastes metallic, and that should improve as she gets started. Bloating, weight gain, the menno belly.
Oh, we could hang out here for quite a
Yes,
while.
we could.
Yeah,
Is there
you-
any hope for that?
Oh, absolutely. Estrogen is the hope.
Yeah.
It is frustrating. The number on the scale is the exact same, or it's creeping up and you've done everything right. You've adjusted your diet, you've ramped up the physical activity, but your pants won't zip and you can't button them. And without the estrogen, it affects your insulin sensitivity, and that is it redistributes your adipose tissue, or the fat that you do carry. And there's definitely a healthy amount of fat. It's there for a reason. But around the belly, it seems to be what happens when we lose our estrogen supply.
Okay, since you're talking about that, this makes me ask the question. So I'm 35 and I haven't really opened the door to nobody's told me. Okay, so I'm ignorant for one thing. I'm just going to put myself in this place.
Right.
And all these weird things are happening to my body and I don't know why. Okay, all of a sudden I've become aware because maybe I listened to a podcast on the Empty Nexter podcast and this amazing doctor said, hey, at 35, you might want to start being aware of what some of the symptoms are. Would one of those things be what you eat?
Absolutely.
Your
the
diet.
cravings that you have,
Yes.
you mean?
Well, just your diet in general. Does your diet affect how well you move into the menopause season as far as your symptoms?
I'm a big cheerleader for HRT, but it needs to be on a foundation of healthy lifestyle choices. And that's just for your health in general.
Right.
So irrespective of what your hormones are doing and how you're supplementing them, you need to get great sleep. You need to prioritize healthy nutrition, a lot of fiber, a lot of fruits and vegetables, and a lot of protein. Protein and fiber, especially in the perimenopausal, menopausal transition and after menopause, need to be a priority. Really, protein at every meal, 20 to 30 grams. The mindfulness and stress reduction techniques. Saying no is a form of self-care.
I'm learning that.
Yeah.
I'm learning that.
And then physical activity. So really strength training needs to ramp up because you have a little bit lower testosterone in perimenopause and menopause and postmenopause. And so muscle building and strength training needs to be a priority. That helps a lot with preventing insulin resistance, diabetes and prediabetes, and cardio exercise. So those need to have equal importance. And then kind of as a side hustle with physical activity, stretching and balance training as well. So
Pilates or yoga, whatever.
I
Yeah.
love active yoga where you get your heart rate up. I really love Pilates and I love bar as a form to get kind of all four of those physical activity modalities, getting your heart rate up to around zone 2.
That's
We
good.
can talk more about that at some
Oh my
other
gosh,
time, but
that's awesome. Yes.
really the key is you have to solidify and you have to create the day-to-day habits of foundational health principles so that you know that those aren't the issue. I can give you better living through pharmaceuticals, but I can't do that for you as a physician. Happy to help support in any way. You have to grow up. You have to do the things that keep you healthy as a principle to maintaining healthful longevity.
That is so good. So you have to be intentional coming into this season.
Correct.
That this is what's coming. Have the right foundation physically. That way, that's one less thing you've got to worry about. Oh, I'm already sleeping good. I'm being mindful to exercise, to say no, to just try to decrease the stress if possible. But sometimes, say you're in that sandwich generation, you've got the youngers like I do. I've got the older. How do you recommend if you didn't start now? What's the one thing to do to kind of get the ball rolling and kick the can down?
Oh, I'm a big proponent of habits. And I think that starts with actually physically writing down what are your goals? What are your goals for life? What are your goals for your health? What are your goals for your marriage? What are your goals for parenting? And then extrapolating what you have to do on the day to day or what you want to do or what an ideal day would look like. So when you solidify that is what you're going to do, when life throws you curveballs, you can duck, pivot, and get right back on track.
Duck and pivot. That is my life right now.
Pivot.
And get right back on track. I mean, yeah.
And not be swayed too far.
Yeah.
Ideally, vacation shouldn't be something that derails you, and that's a fun thing.
Right.
A hospitalization or a loved one's illness shouldn't derail you from your habits. It needs to be who you are.
That's good.
And when you really identify what your goals, it makes it easier to say, I'm an exerciser. I exercise, this is me personally, but I exercise at 5:30 every morning. I am a human being, which means I will come up with an excuse to not get up and go.
Absolutely.
But it's also my job as a grown-up 46-year-old to say, nope, get in the back seat. We are going to exercise.
I love that. Yeah.
Along that line, and talking about diet and menopause, there's bone loss in menopause. And I saw a video where this lady said you lose a third of your bone mass in menopause. And what you're saying, these habits and jump training and protein and things like that will help us maintain our bone mass.
Yeah, you lose about 6% bone mass every year.
So she was a little
postmenopausal.
off.
Wow,
Well, no,
that's a lot.
every year.
Every year.
So it adds up. Yeah.
Yeah.
Oh.
Yeah.
Wow.
And you are 50% of hip fractures never get back to full functionality.
Really?
It used to be, before we had good rehab, 50% would die within a year. It's better than that now. But if we can prevent that hip fracture and prolonged hospitalization and dehabilitation and deconditioning, then it will prevent other potential complications like pneumonia or hospital-acquired infections or loneliness in a nursing home because you can't take care of yourself.
So balance is also a big
Huge.
one.
Yes. Yeah. Moving. Like my 86-year-old mother, I'm like, Mom, she has her little walker. She calls it her Cadillac, but she moves every day as much as she can.
Your mom's a rock
You've
star.
got to be in motion. I don't want to do it either, but my joints thank me. There has never been a time that I have exercised that I said that was a waste of an hour.
Right.
No.
Every time I do it, I'm like, thank you, Lord, that I can do it, because I see women who probably wish they could and they can't because of what other physical limitations. But also there's so many resources out, like YouTube alone. If you're laid up because of a knee issue or whatever, you can sit in a chair and lift weights.
Chair yoga is a big one.
I mean, the excuses have to leave because there aren't anymore. There's too much out there available.
Lots of gyms cater to the seniors teaching them these things.
That's true. Yeah. And strength training is so important. And we aren't taught as women to go lift weights.
They think we're going to bulk up.
Yeah. You're going to get huge. You're going to be too bulky.
Right.
And your shirt sleeves aren't going to fit right. No, it is still so important to focus on strength training, especially in your 50s, 60s, 70s.
Have you heard of the vibration plates that are big right now that you stand
I'm glad
on?
you brought that on.
I have one, and they say I do it after I exercise. I don't know who they, it could be Slash and Axl Rose. I don't know. That it helps your soreness after workouts, but it also helps your bones. Do you know anything about a vibration plate?
Not necessarily vibration plates, but rebounding is pretty popular.
It's a similar thing without having to jump and
it
mess
helps with the
bladder.
lymphatic. Yeah, the lymphatic system helps with drainage, which can help improve lubrication of the joints, clean up inflammation, so it doesn't linger there.
Speaking of a rebounder and bladder, is a fallen bladder typical in menopause? I know a lot of lady friends that have had to have theirs tacked up.
Yeah,
is that a
you're looking at
common
one
thing?
Oh, wow. Okay.
So yes, you can have stress incontinence, which is when you're sneezing or jumping on a trampoline and you leak urine. You can also have urge incontinence, and that's when the bladder spasms or cramps down so that you have to get to the bathroom right then. Otherwise, you leak. Oops, and you feel it.
Yeah.
And so the lack of that, again, robust mucosa down there doesn't help support that. And so you can do just topical vaginal estrogen and periurethral estrogen, and it can help improve menopause. And then there's pelvic floor PT. A big shout out to my pelvic floor physical therapist, Dr. McGowan. You know who you are. I awesome. Definitely perimenopausally will recommend people see their pelvic floor PT just for the feedback that they can get from another person kind of that's an expert and assessing the situation.
So you could do that in lieu or before a surgery to see if you could forgo the surgery.
Yes. So I, in 2019, had a combination of a hysterectomy, kept my ovaries, and a bladder sling because I couldn't walk and sneeze at the same time. And it was great. But when you take the uterus out, that's a structural scaffolding for the bladder in front and the rectum behind.
Yeah.
So the pelvis kind of has to readjust with those two organs. You can get rectal prolapse, you can get bladder prolapse, and a lot of times the sling lasts about 10 years and sometimes has to be redone. But again, a pitch for pelvic floor PT because that can help a lot for that as well.
Oh, that is good to know.
That is so good to know. Can I pivot over to the mental aspect of it all? Because I was having a conversation with my boss, and his wife has been in menopause about 10 years, and he would make the comment, and please, any men, I don't know any men that might be listening, my husband may be one of them, but when men say, oh, she's just in menopause, and they just throw it as her moods are swinging, she's not whatever, and they just blanketly say, oh, give her a pass, she's just in menopause. And it's like we're trying to use that as an excuse, but we're not. It's reality to us. And the mental aspect of it, sometimes I feel like my brain will not quite, it's shifting, it's not firing right. I'm moody one minute, I'm crying the next. Yeah, things like mental clarity. What part of the whole body where does that come from, that part of it?
There's so many estrogen receptors in your brain, and they've recently found out that your estrogen receptors upregulate. When you don't have a lot of estradiol or estrogen circulating, usually the receptors go down. But our brain is starving for estrogen. And so it goes up. It's going to get every little bit that your ovary, can put out all the way to the very end. And so brain fog is huge. I walked into this room. I have no idea why I'm here. The mood swings, sudden and significant anxiety. the women in their 40s tend to be one of the higher groups of people that have new onset of major depressive disorder, and there's really no precipitating factor, no environmental trigger, nothing like that. And menopause or lack of estrogen is frequently at play. I have a patient who, her husband's an airline pilot. They fly everywhere. She suddenly is afraid of flying, has a fear of getting on an airplane. And I'm like, you know what? There's a good chance when it comes out of nowhere like that, yeah. When we talk about other people and saying, oh, well, they're just in menopause and how they deal with it, I would kind of look to you. How do you want to deal with it? Yeah. How do you want them to deal with it? If you want to put up with it and don't want to go on hormones, then it is a phase and you're going to have an excuse, but it doesn't have to be that way. Yeah. And that's what I mean when I say don't be a martyr. Don't just lay down, put up with it, let the truck run you over back and forth with that lack of hormones.
It's like going to the dentist and not wanting Novocaine to get a tooth pulled. Why would we be okay with that? When we have so many resources available to us now.
I want the Novocaine.
Give me all of it.
And the nitrous.
Yes, I want the gas.
The nitrous, yeah.
Well, you ask why. It's not for everybody. There are some people who don't tolerate any of the formulations. And I ask people to be patient. That's why it's so important to go to a doctor who knows what they're doing, who has experience, who can get you your personalized combination, even if it's supplements, even if it's a food plan or hormone replacement therapy. And there are some people that it's actually contraindicated in. So if you've had a blood clot, systemic estrogen is worth a conversation because it does increase the risk. It's one of the reasons I usually start with a patch because it doesn't go through the liver, which is what makes those clotting factors. And it has a lower likelihood of clot, but it's still higher than if you weren't on it at all. Breast cancer, active breast cancer is somebody that I wouldn't be comfortable prescribing, especially if they're estrogen or progesterone receptor positive on that breast cancer tumor. So the big thing to know is if you have a family history of breast cancer, it does not take you off the table for being a candidate for menopause hormone replacement therapy.
My head is just, she's been my doctor for 3 years, I think. And now I'm thinking, gosh, wish I would have known you when I had the hysterectomy. I was in the 40s and going through the situational, circumstantial of taking care of my parents. So the depression from that and then just going crazy from this.
But in full transparency, I was a typical doctor at that point and hadn't done any more reading, any more research, any more continuing education. So I would have said, let me know when you've not had a period for 12 months. And then we'll talk about it. And
so God gave you to me at the right time.
For all of our benefits. That's fabulous. So I think the other question I had, going back to the belly fat thing, I just want to go back there because at one point my body was shaped like this. And then all of a sudden I blinked twice and it's like this. Why does everything seem to reallocate right here?
It's rude.
What part of it all is there a reason? Am I storing up fat for winter later on?
We're hunters and gatherers now.
Am I a bear now and I'm going to hibernate and I need all that extra fat to keep me warm? And what's the reason?
It's like med school 301, but with a really broad 30,000 foot view, it affects your insulin and it affects how much your body tissues are sensitive to insulin. And so people that are on high, like the men's beer belly, right? If they are on high simple carbohydrate eating habits, they are also going to store that central adiposity or central fat distribution. And so it has a lot to do with how sensitive your body is to insulin, and estrogen plays a big part in that.
That makes sense.
We haven't talked about progesterone. Let's dive into that.
Please do. That's my night pill.
Mine too. Love it.
So estrogen, you have benefits even if you have zero symptoms of menopause. You have the benefits of, again, decreased cancer, decreased osteoporosis, decreased potential for Alzheimer's. They're studying that more, but anecdotally, it's seen all over the place. And then just the mental stability as well. So progesterone is not quite the same. We know that you need progesterone if you have a uterus so that estradiol or estrogen that you're taking doesn't make the inside lining of the uterus overflourish, which can over months to years lead to endometrial hyperplasia, potentially endometrial cancer. So if you have a uterus, you get estrogen and progesterone like they're salt and pepper.
Yes.
They go together. I don't pass them separately at the dinner table. You get them. They're a package deal. But you can take progesterone alone. And one of the benefits of progesterone, two of the benefits are mental health. So they help with anxiety, they help with depression, and they help with sleep, like you said, the night pill. And so vasomotor symptoms of menopause, that's going to be the hot flashes, going to be the night sweats. They lead to a lot of insomnia, but you can also have just primary insomnia that's worse with menopause that doesn't have anything to do with a hot flash or a night sweat or getting up to pee for the eighth time. And it can really be benefited with progesterone. Yeah. And so there are people that are just on progesterone to help with some of the symptoms to stabilize mood. In fact, I have a lot of 30-year-olds on progesterone. Really? They're like, what is happening to me?
Wow. So they are still cycling.
Oh,
and
yeah.
Okay.
Good to know.
That is good to know.
Yeah. So if we're going to educate the next generation, would you say 30 is about the time to start saying, I have people in my life that are about that age, say, hey, why don't you start educating yourself on here are some of the things to look out for in the next 5 to 10 years?
I love AI.
Yeah.
And I love ChatGPT.
Yeah.
And if you have a symptom that's concerning, put it in a ChatGPT and ask, could this be a perimenopausal symptom? And odds are good, yes. But that's another reason to speak with a doctor that knows you. It could be your thyroid. It could be prediabetes. It could be an autoimmune disorder. So it's not the answer to everything. But if you can't find an objective cause medically, there's a good chance that it could be fluctuating hormones. And that's hard for doctors because there's not an objective test. Yes, we can test levels, but it doesn't tell us the dynamic picture unless you're doing blood work every day.
Yeah.
And there are some newer functional tests that aren't entirely validated words that aren't entirely validated by Western medicine approved standards that can provide some insight that I'll do sometimes, but I'll ask people to take it with a grain of salt. Insurance never covers it. It's expensive. But it can provide some helpful information. People are desperate, and I would be wary of doctors that take extra money just because of a test or medicine that they can offer. I definitely walk the tightrope between functional medicine and traditional Western medicine, but this is science-based and science-backed when it comes to hormone replacement therapy. We know now. There's a lot we don't know. Right. So thankfully, we're getting the word out. There's a lot more advocacy. Yes. Write to your congressman. Give more money for menopausal research.
Just women in general.
Yeah. I guarantee you, if men had equal vaginal atrophy of their shriveling
and the
up,
dryness prescription would not be as expensive.
The money would be flowing.
Yes, it would be.
Now that you mention men, though, don't they go through something somewhat similar at certain ages? Do they start going through losing testosterone and all? Because I've got family members and friends who take
testosterone.
Yes. So that's a real thing for men too. The aging process affects everybody, just not women only.
Yes. So it is, there's definite medical diagnoses that are scientifically proven to, that are FDA approved for testosterone. Low libido, low muscle mass isn't one of those things, actually. These T clinics or low T clinics have popped up everywhere. And so that's a whole nother podcast, a whole nother conversation. But it is important to know that testosterone is a female hormone as well. Yeah. And we need levels about 1/10 of what men do. And I prescribe testosterone for women who need help with libido and who need help with maintaining muscle mass. Yeah. Those are the two big indications, things that we'll talk about. I rarely start all three at once. I want to know if you're having symptoms. I want to know if it's too much of estrogen, or is it too much progesterone, or we need to back down or change formulations or increase. And so testosterone's one of the latter conversations in a menopause or hormone replacement journey, but it's still important to bring up. And men have a gradual decline. And it is strongly influenced by lifestyle choices as well. Sleep apnea is a huge reason that men's testosterone nosedives. Lack of physical activity, weight gain due to excessive eating, or different, the unhealthy foods or unhealthy timing of foods. So,
wow, that's amazing.
That is interesting.
So I think the biggest thing I'm hearing is we need to be advocates for ourselves. We need to start making ourselves put ourselves first and take the time to understand how God made us.
Yeah.
And, I'm late to the game, but I'm here. We are all here, like you said, kicking the can down the road. And the goal would be to wake up the next generation, because a lot of them think, oh, well, that's like 10, 15 years down the road.
That's a grandma thing.
That's right. That's what I thought too. Like when I was 30, I'm like, menopause?
Yeah.
That's
I don't want to talk about
that.
It is, but I think if we are more aware, that road sure will be easier to walk down than just be hit in the face by all of a sudden. Literally, the first time I had a hot flash, I was at work. I was in a meeting upstairs. I didn't know what was going on. I came downstairs, stripped in my office, turned on the fan. One of my girlfriends came in, who was 10 years older than me. I said, "What is happening?" And she goes, "Welcome to the club." I'm like, what? I literally started crying because I didn't understand what was happening to my body.
I did not sign up for this.
No,
Here's
the
my
internal
card
furnace.
back.
Yeah.
It is a hard thing. Scott used to rub my back, and he would just be rubbing on me, and he would snatch his hand back, and he'd go, "You're having one of those hot flashes." Because you can feel it.
Yeah. Yeah.
Your body's on fire.
That is too funny.
So I want to go back to one thing you said. So I can take hormone replacement until I'm 91.
I have women in their late 80s and 90s that are, if you take my estrogen, I'll cut you. I'm like, okay.
Whoa.
Okay.
That might be me.
Yes, ma'am.
Because it makes a huge difference.
Yeah.
It's a conversation. It's, you have a slightly higher risk of breast cancer. They're willing to take it. They're the ones that get mammograms every year. That is one thing that's very important to me. If I have a person on hormones, I don't want them to get breast cancer, even though the incidence of breast cancer isn't higher when you use hormones earlier, like in your 40s and 50s, even into your 60s. If you get breast cancer that has an estrogen or progesterone receptor on it, you could be feeding it. So you don't want to be feeding it unknowingly. Right. And so that's why yearly mammograms are still gold standard for assessing the potential for breast cancer. They're not perfect. There are better tests. MRI is great, but it's stupid expensive and insurance doesn't cover it. Right. But if you're not willing to get a mammogram in my practice, then we talk about alternatives, but you have to do some sort of breast cancer screening.
Right. And I'm just going to throw this out there for you ladies that are self-pay or have a high deductible or your insurance doesn't cover mammograms. Call City of Hope in Noonan. Yeah. You get a 3D mammogram for, it used to be $99. I think they went up to $109 last year. I go there every year for my mammogram.
That's great. Wow. Man, I could sit here and talk to you all day. Is there anything else that you want to make sure we are informed of
Yeah,
And,
practical tips for the wild ride. So
on.
start tracking your cycle, your symptoms, and your sleep. I would say mid to late 30s.
Oh, wow.
Advocate for at least getting baseline labs. Bone density decreases. So if you're worried you've been a while without adequate vitality hormones of estrogen, progesterone, even testosterone, get a bone density screening earlier. Don't dismiss libido concerns. It's not just something that has to happen. You can want to have sex again.
Whoop,
Yeah,
whoop.
that's good. Yeah.
And then speak openly with your partner as well as your physician about what your concerns are, what your changes are. And if you do not feel that you're being heard, especially with your doctor, then find another doctor. And
Yeah.
one of the nice things about the Menopause Society is that it is a group that has been dedicated to research and education and furthering the care for women going through menopause in an appropriate manner. And this certification allows patients to find doctors who have been willing to do that further education.
That's fabulous.
And so
That is.
go to the menopaussociety.org website and you can look up menopause certified providers in your area.
Yeah.
And if you're in this area,
hey, we have a great one.
I have a great one. And she's a concierge doctor. And if you're not familiar with that, I highly recommend you go to her website. It is a very cool service.
Yeah. I think a lot of it too is staying in community with other women that are in the same season as you are
Absolutely.
and having conversations,
Yeah, 'cause
because
things
I've learned
come
so
up.
much. Yeah, I've learned so much from the women that are 10 years ahead of me. How did you handle it? What did you do? Any advice? And some of them knew and some of them were just as ignorant as me.
Yeah.
And they're in their middle 60s. But I think having conversations more and again bringing it out into the open, and it's not a bad thing.
No.
This is just part of our evolution as human beings.
It's how God made us. And
thank you.
we can also go with the technology and the science that he also gave us the
Absolutely.
intelligence to help improve the symptoms. So again, we can do his will here on earth with vitality.
I think that to me, if you have anything else, I would like to end on that because I feel like you hit the nail on the head. I cannot be my best, and my tagline for this whole podcast is I want to live my best next. And the only way to do that is to take our bodies are the temple of the Holy Spirit. God created our bodies. It's up to us how we treat them, how we educate ourselves about them. And if you don't know, ask.
Yeah.
And like you said, ChatGPT is a wealth of information, but also finding a doctor that will listen to you and say, please tell me I'm not going crazy.
It's not in your head.
No, it's not. And sometimes, I ain't gonna lie, I've used I'm hormonal today, leave me alone, give me a pass. You can't use that every day. That's just an excuse to not want to get it fixed and be better.
Yeah.
And the goal here is we want to live our best next with joy and purpose as we continue to walk down the road. And I want to be a very vital, active 80-year-old.
Yes.
I'm sorry. I refuse to just let this body dictate to me what it's going to do when I have the ability to tell it. Like,
That's
hey,
right.
It starts now.
That's right. And even if you're 55, 60, you can start right now.
Yeah.
It's never too late. And as a disclaimer, which I probably should have said at the beginning, every person's story is different.
Yes.
It's not one size fits all menopause life, peri, post, whatever. It's your journey is unique to you. And we want to be sympathetic that some people are in the deep throes of it and do not know how to get out. But we do have resources available in our community. Take advantage of them.
Yes.
And call a friend, and God will get you through it. But you've got to realize, okay, I need to make some changes. I need to change my diet.
Yes.
I need to start de-stressing my life and working out with weights. Like Dr. Krista said, those things are practical things that you can put into
and
action.
even supplements. She recommended lion's mane to me for the brain fog. It has been a game changer.
Wow. Amazing. Wow. Well, Kelly, you have anything else you want to add before we close?
No, I
Dr.
don't.
Krista, anything, words of wisdom as we
Thank you for having me.
thank you for what you're doing, because to me, 10 years ago, your field to me didn't even exist.
No.
I didn't even know you were out there. Thank you for being on the front lines to help us understand what's happening, to where we can have a group of women coming up behind us. And that's always my heart, is that I want to reach back to the generation behind and say, hey, we are trying to pave the way as best as we can. You know, we're not going to get it right, but we sure are trying to illuminate the path for you. So take advantage. So with that being said, we are going to shut the episode down, and you go out and live your best next. And when you're having a bad menopause day, just, in my opinion, Dr. Krista might agree or not, but just go get some chocolate and
Amen.
turn on Cyndi Lauper, and let's girls just want to have fun, right?
Amen.
All right. Y'all have a great one. Thank you, ladies.
Thank you. Bye.